Welcome back to San Antonio Living. And today we're calling it the Man Show. We're concentrating on things you should know about men or your man. And I'm joined right now by Dr. David Cantu from the University of Texas Health Science Center. Now, you're a physician teacher.
Yes.
So you teach medicine, and then you have your own private practice, or what do you call it?
I have my own practice within the medical school.
Oh, terrific.
Yes.
All right. So anybody can go to you.
Yes, absolutely.
Whether it's through the university or just walking in, right?
Right, absolutely. We see all patients. We have a regular practice. However, all the doctors in our clinic, in our practice, are teachers of medicine.
All right. Now, you've seen what we've been doing for this hour.
Right.
Kind of goofing around, talking about men, and we're talking about sometimes we don't do what we're supposed to do. Now, we were talking about men's health, and we have 5 questions here. And you've seen the question.
Hold on. I got the first question.
Okay.
All right.
Okay. Question
Dr.
is,
Cantu, is this the appropriate diet for someone?
chicken fried steak.
Question 1, is this a good thing to eat?
Delicious?
Sorry.
Yes.
Delicious, yes.
Healthy? No.
Probably not. Portion control? Not so much. But again, I say, if you eat, you can eat calories if you burn them off. If you're working out there digging ditches or working on the farm, you have a lot more calories you can take in than the regular guys.
Well, sure, and that's actually the first question I think all men should ask their doctors is, am I at an appropriate weight?
There you go.
And when we look at the appropriate weight, it is a balance of the calories you put in versus the calories you put out. If you put in more calories than you burn, you will gain weight. If you put in less calories than you burn, you will lose weight, and if you make it even, it'll balance.
It's a simple balancing, but is there a certain weight for height and age?
Absolutely. There's something called the body mass index, or the BMI, and that is something each individual person can ask their doctor. And the BMI is a proportion of your weight and your height, and there's charts, because it's a complex mathematical equation, but there are charts to look at your height and what your weight should be.
Where you should be. All right, let's go to the next question.
All right, question 2.
Question number 2. Okay, question
when I
number
go
2.
to the smokehouse, do I get the pork ribs?
Or the beef ribs?
Or the beef ribs?
That's question
or
number
what
2.
exactly should I get when I go to the smokehouse? What kind of barbecue should I order?
Which one do you like?
Oh, I like them all.
Oh, well then get both.
Actually, I prefer the pork ribs.
What do you suggest, Doc?
I think if you're going to go to the smokehouse, and that's okay to go to the smokehouse, and it's portion control.
It's just how many
It's how many do you eat?
Less than 12.
And
yes, less than 12.
and you want to have the proportion. And eating good food is fine as long as it's in the right proportion and you don't overdo it.
Portion control. Only 2 ribs for you.
So I can go back as much as I want then? Just have a couple, then go back?
No.
It's not like having the one bowl of cereal and you fill it up 5 times. No.
Here's the next question, Doc.
The next question is, when should I start worrying about my heart?
Yeah, for men.
For men.
Is it different from a woman?
Well, no. I mean, women should also worry about their heart. But men, what I see in my practice a lot is men coming in when there is a milestone in their life. I'm 40 years old and I'm worried about my heart, or I'm 50. Or something happened in their family. Their dad had a heart attack, or one of their best friends had a heart attack. So now they start thinking about their heart health. And the time for men to worry about their heart health is now.
Is now. Even at 22,
regardless
25,
of age.
8?
Absolutely. And actually, if you were to talk to your doctor and ask your doctor, what can I do to keep my heart healthy, regardless of age, what that will do is open up a conversation about all of the things that affect your heart health, including weight, as I mentioned, as well as blood pressure control, as well as cholesterol control, diabetes, family history, all of those things.
Start the discussion about the heart at any age.
Absolutely.
All right, one more question. What can I do about my receding hairline? That is like the $64 million question. Is there anything you can do about it?
Well, first of all, male pattern baldness, which is what we're talking about here.
Alopecia, don't we all know about that?
Yes, male pattern baldness is a genetic problem, and it is actually transferred through the mother's side of the family.
Mother.
Yes.
So if your mom is bald, you're going to be bald?
Well, if someone on your mother's side of the family is bald, you may have an increased risk of baldness. What can you do about it? Really, there's really nothing you can do to stop your predisposition for baldness. But there are some treatments. There's oral medications. There's topical medications.
The Rogaine?
Yes, those kinds of medications.
Propecia?
Absolutely. And then there are surgical treatments as well, like hair implants. So there are options. And there are, yes.
All right, let's go to the next question. Oh, this is tricky here. Why is there blood in the urine?
Yes. And
now, is that serious? That's a serious sign?
It is something that should not be ignored.
Okay.
I've had patients kind of tell me, oh, by the way, as I'm walking out the room, oh, I have had some blood in my urine, and what should I make of it? But it can be a serious condition. And I like to use this question, not so much to speak specifically about blood in the urine, but to say that anything that a man is concerned about regarding his own personal health, he should bring it up with his physician.
Next question, or our last question is, 20 years ago we wouldn't have discussed this, but now it's a big discussion. ED, erectile dysfunction. Is that something that a man should say or even notice? I mean, does he notice? Where's the issue here?
Yes, erectile dysfunction. A man can notice that he's having troubles gaining an erection, and he should bring that up with his doctor. You're right, men used to be very timid about bringing up the problem, but they should talk to their doctor about it because there are different causes for erectile dysfunction as well as different treatments available.
So if you have more questions, you can contact Assistant Professor at UT Health Science Center, Dr. David Cantu. Thank you for your time. He's with the Department of Family and Community Health. Give him a jingle there at 592-0150. Thanks, Doctor.